Hi, this is Dr. Paul Angelchik, plastic surgeon from Glendale, Arizona, and I'm here with some patient pearls about tummy tucks for you. In medicine and surgery, when we talk about a pearl, we're talking about a key piece of information which helps us understand something. So I want to give you some key pieces of information to help you understand what a tummy tuck is, who it's for, and what to expect if you should decide that's something that you're interested in. So a tummy tuck is an operation that helps to make your tummy look better. That's pretty obvious, right? And it consists of several components. So we're addressing the problem of loose skin with stretch marks, the problem of muscle tone that's not very good, that's making the abdomen lose its best shape, and the problem of adipose tissue or fatty tissue. And we're talking about the fatty tissue between the skin and the muscle wall. We call that somatic fat in the medical parlance. Visceral fat, on the other hand, is fat that's around the vital organs inside the abdomen. So the tummy tuck addresses the loose skin, poor muscle tone, and somatic fat to some extent. And we'll talk about that in a moment. The operation is generally for female patients or male patients who've had massive weight loss. Also, sometimes we'll have this procedure. So when patients are done having children and they see loose hanging skin on their tummy and they've lost some of the muscle tone from childbirth, that's a time that they would come in and see us about a tummy tuck. The ideal candidate is going to be someone who's height and weight proportionate, who's in good health, who has a little bit of help at home, because you're not going to be able to do household chores and some lifting activities for the first weeks after surgery. And somebody who doesn't have a lot of visceral adiposity, because if you have a lot of fat around the vital organs inside the abdomen, the operation is not going to do as good a job of shaping as you would like it to. And so that's something you have to address with lifestyle changes like diet and exercise. When we have a patient come in for their abdominoplasty consultation, we take a medical history. We're going to do an abdominal exam. We're going to look at where there is loose skin on the abdomen, how much is it in terms of the amount of laxity to figure out what kind of tummy tuck will work best. Is this a mini tummy tuck? Is this a full conventional tummy tuck? Or something in between, like a Saldana, Brazilian abdominoplasty? Does the patient have any hernias or anything going on inside the abdomen that would be a contraindication to surgery? A hernia by itself is not necessarily a contraindication to a tummy tuck, because sometimes we'll fix that at the same time. And we're also going to look at the surrounding areas. Many patients will have liposuction of the flanks at the same time as their tummy tuck to get a nicely sculpted waistline that goes all the way around the torso. If a person's had massive weight loss, they may be a candidate for something more extensive, like a lower body lift or a circumferential belt lipectomy, because they have laxity of skin all the way around. The tummy tuck operation is done at the surgery center. It's done under general anesthesia with a board-certified anesthesiologist. There are no stitches that need to come out from the incisions. These are dissolving stitches which will go away by themselves, and they're under the skin. The stitches that we use to tighten up the muscle fascia, the connective tissue on top of the rectus muscles, those are the six-pack muscles, are permanent. Those are deep, and those help to keep the shape of the tummy afterwards. When you have the operation, if you have a full conventional tummy tuck, I keep you overnight at a recovery facility to keep an eye on you, make sure that you're doing okay, you have adequate pain control, and then you go home the next morning. If you have a less involved procedure, you can go home the same day, and we'll see you in the office the next day. Post-operatively, you're on antibiotics for a period of time. Pain medicine is available, obviously, as needed. We use Exparel, which is a long-lasting local anesthetic that we inject right into the muscle sheath to help give you some numbness in those areas for about 3 days. And that really helps get you over the initial hump as far as discomfort goes. And then we give you something for nausea if you need it from anesthesia or medication. I do use drains in my tummy tucks. Most of the times the drains are out by a couple of weeks after surgery. I also use quilting sutures internally as well for control of swelling. Post-operatively, at about 6 weeks, you can basically do whatever you'd like. The first 2 weeks, I want you walking and moving, but not lifting anything more than 10 or 15 pounds for about 6 weeks. At 2 weeks, you can start to do low-impact aerobic exercise. The other thing is for the first 6 days and nights, you can't extend your torso fully. So you're flexed at the hips when you're walking about 30 degrees, and at night you're going to sleep in sort of a beach chair position. The reason for this is the skin is going to be fairly tight after the procedure. After about 6 days, the skin relaxes a little bit, the blood supply adjusts to the changes that we've made in doing the surgery, and it's safe to start extending your trunk. It'll take about a week or 10 days to get there. One alternative to the tummy tuck for patients who don't want to go through that procedure or who have less extensive issues in terms of their skin laxity and muscle tone may be to do liposuction and internal skin tightening with the Renuvion device. The Renuvion is a helium-ion plasma beam device, and you can find information on our website about this, which tightens what's called the fibroseptal network. These are connective tissue strands that run from the undersurface of the skin down to the surface of the muscle. And when you use the Renuvion device, it will contract collagen and cause new collagen generation. It basically shrink wraps the skin. It's not going to make you as tight as a tummy tuck will, but it does make a significant difference. And if there's a little bit of loose skin at the bottom, we can excise that at the same time without doing muscle tightening in the right patient. So if you're an appropriate candidate, that's another alternative, and we call that the modern tummy tuck or the modern mommy makeover when we combine it with breast surgery. So I hope this was informative for you.